Authorities in Colorado uncovered 1.7 million counterfeit fentanyl pills in an auctioned-off storage unit. That's the largest drug bust in state history. The winning bidder for that storage unit found 12 kilos of fentanyl powder and then, of course, alerted the authorities. They're now investigating where the pills came from and who they were intended for. That's a lot of fentanyl. Now this, OVAX Chief Executive Officer and the co-founder of the company, Collin Gage, he was on this program last year. He told us about the company's fentanyl vaccine. Watch this.
Unfortunately, so I had two childhood friends who passed away. And that inspired just to take a different view here. Whereas everything on the market to date has been reactive. We always react to overdose. I think we need to flip that paradigm. We need to be proactive. We need to prevent overdose, not react to overdose. So far in animals, it's shown very robust efficacy, and now we need to translate that into humans. That starts in 2025.
1 year later, Collin Gage is back and is with me here on set in New York City. Your vaccine is set to start, I think it's clinical trials. That will be next month, December. What progress can you report over the past year?
Yeah, so thanks for having me back on. We've since changed the name to Armor Sciences because we're really focused on providing armor to every citizen around the nation, starting with military and first responders. So, you know, the progress over the last year has been tremendous. We've seen this immunotherapy block 98% of fentanyl from reaching the brain in animals, which is almost a complete blockade. The downstream effects of that are a 100% elimination of the addictive behavioral effects, which means this could really be a game changer for all those out there suffering from opioid use disorder, but also the inadvertent exposures, you know, the teenagers, college students that are taking what they believe to be something else and being poisoned by fentanyl.
Now, the clinical trials are next month, December.
Yeah, so we plan to start either next month or at the latest January or February.
Are that's tests on humans?
Yeah, tests in humans, normal healthy volunteers.
How do you do that?
It's a good question.
Do you give them some fentanyl and see and vaccinate them?
We do have to see the effects of our immunotherapy against fentanyl. So yeah, we are going to be administering fentanyl. It's done by highly trained anesthesiologists in a medical setting, of course.
Sure.
And we will, you know, obviously have currently available treatments on hand in case anything goes wrong, but we're very optimistic about the safety and efficacy of our formulation.
How soon when it's deployed in society?
There are a lot of avenues that this could take. Obviously, it's no secret that President Trump is doing more than any other sitting president in history, you know, especially when it comes to the fentanyl crisis. This could be, you know, potentially on the market within 2 to 3 years, 3 to 5 years. It depends on many different regulatory hurdles that we have to go through. But I think this president is very much behind ending the fentanyl crisis and taking any means necessary to do so.
The company's called OVAX, right?
Armor Sciences.
I'm sorry.
Actually.
Now it's Armor Sciences.
Now it's Armor Sciences.
Where are you getting your money from?
Good question. So we've primarily been funded. Actually, our research was funded by the Department of War originally, which is fantastic. They supported us due to, you know, fentanyl being a potential chemical threat, and really it is a national security crisis that we're dealing with on our soil. One of our advisors, Derek Maltz, is the former acting director of the DEA. I mean, he calls this a weapon of mass destruction, and others in his network call it a weapon of mass destruction. And I don't think it's far from it. I mean, there's no secret that this is really being done on purpose to the United States. We're not losing hundreds of thousands of innocent lives by accident. This is war in America.
Well, Collin Gage, we wish you the best of luck with the clinical trials next month, and come back and see us again and see how you're doing.
Thank you so much.
Thank you, Collin. Good to see you.